Hello, I'm Dr. Jha, Director of Renewed Skin and Health Clinic in Royal Leamington Spa in West Midlands. Today I'm meeting Mr. Sanjay Azad, who is a consultant plastic surgeon and cosmetic surgeon based in Birmingham City Hospital. And today we'll be talking about fat transfers done as an office-based procedure under local anesthetic. Hello, Mr. Azad, how are you?
Hello, Dr. Jha, how are you doing?
Okay, so tell me a little bit about the fat transfer. Where does this fat come from and where does it go?
The fat transfer is a relatively new procedure. I've been using it for many years now.
Right.
But it's been sort of, more described for the last 10 years.
Right.
And basically it's your own fat which is used and can be transferred to any areas of the face. Now, you get a lot of patients who come asking for fillers on the face.
Sure.
But we all know that the temporary fillers have got their own problems. They're good to start off with, but invariably they will disappear over a period of time.
Sure.
And personally, permanent fillers is something which I do not recommend because of long-term problems with them.
Sure.
So fat becomes one of the best options because it's your own tissue and it can be transferred to your face.
That's very good. So it's done under local anesthetic?
It can be done under local anesthetic. If there's an extensive fat transfer on the face, of course it may require a general anesthetic.
Sure.
But the procedure itself involves using very small metal tubes and you can take the fat out from any part of your body, particularly the tummy or the thigh area, and then that can be transferred to the face with very small incisions under local anesthetic.
Okay. All right. And what are the target areas? You said face you do fat transfer. Where else it can be used?
But the fat transfer can be used for any part of the body. Anywhere where there is a contour deformity, it can be used. I use it a lot in the breast area, and also it can be used for patients who've had liposuction in the past and have got contour deformities or fat fracture. In those areas, fat transfer is a very good procedure.
Oh, that's very good. And so, as an alternative to breast procedure or breast implants, fat can be used?
Certainly, it is an option for patients who do not desire to have an implant. Of course, we know that implants are very safe and have been used for many years. But in the selected few patients who do want fat transfer, that can be done. The only limitation of fat transfer in the breast, in a breast augmentation situation, is that you can only increase the cup size by 1. You cannot increase the breast, too much in size, as you would with a breast implant.
Yeah. Any complications during or after?
The main issues with the fat transfer is that once you put the fat in, some of the fat will disappear. So in trained hands, in the competent person, about 60 to 70% of the fat will stay long term, and about 30% will go away. So the result can be easily assessed at about 3 months, and whatever result is achieved at that point is a permanent result.
So the volume loss from the face, we do see lots of ladies who have lots of volume loss, especially from the temple area, so from the cheek area and so on, and they can be easily dealt with these fat transfer. Is that right?
Yes, it is a very dynamic procedure for these areas because there is no other way of dealing with it. And with any facial aging, you are bound to lose fat because you lose volume, and also the other issues are, of course, of loosening of the skin. So those are the two main elements of treating facial aging. Of course, there are some patients who really require fat transfer along with a facelift procedure or a lid lift procedure. But either of the procedures work hand in hand.
Oh, fantastic. Well, thank you very much for information.
Thank you, Dr. Jha. It's very nice to meet you.
Thank you.